Hello and welcome to Pharma Time. Today I'll discuss about antibody resistance crisis and impact of COVID-19 on antibody resistance. So a lot to know, a lot to discuss as always. But before we begin, please subscribe Pharma Time. Guys, Pharma Time going to launch a PDF interview course. By help of this PDF, you can easily crack your interview for marketing or production. If you book now, you can get the PDF on attractive price with great discount. For more details, you can check the description. So, antibiotic resistance crisis জানার আগে জানতে হবে what is antibiotic. An antibiotic is a naturally occurring semi-synthetic or synthetic type of agent that destroy or inhibit growth of microorganism. When we use excessive amount of antibiotic treating infection from microorganism, that antibiotic does not destroy 100% of microorganism. 1 to 2% of microorganism থেকে যায় যারা ইমিডিয়েটলি নিজেদের মিউটেশন ঘটায় রেজিস্ট্যান্স তৈরি করে against this particular antibiotic, and then antibiotic can unable to treat against this particular bacteria. As we know, lack of effective antibiotic will face antibiotic resistance crisis. That's why don't use any kind of antibiotic without doctor's advice. As we know, we don't have an infinite source of antibiotics. We have limited generation of antibiotics to replace those antibiotics that are no longer effective. New antibiotic development process is very slow and limited around the world. As we know, antibiotics are very much important for human body. One study says more than 80 to 90% of people around the world will prescribe an antibiotic at some point in their life in limited quantity. After registration of antibiotic, treating the patient will difficult. May we have to give higher dose or alternative drugs. For higher dose, we have to pay more money. Antibiotic resistance process may occur in 3 types. TDR means totally drug resistance, XDR extensively drug resistance, MDR microbes resistance to multiple antibiotics. When patient admitted in hospital with COVID-19, earlier hospitals are treated with antibiotic to protect or cure against secondary infection, respiratory illness. COVID-19 is a viral infection disease not affected by antibiotics. Antibiotic resistance already a crisis. A huge number of patients are suffering for this problem, and COVID-19 can increase this problem future. A study was conducted on 191 patients in 2 hospitals in China. They found 15% of patients develop secondary bacterial infection because of weak immune system for COVID-19. In 1918 Spanish flu pandemic, on that time majority of people are dead because of secondary infection. That's why don't use any kind of drug without doctor's instruction. Thanks for watching Pharma Time. God bless you all.